Vikki Petersen here. I wanted to speak with you today about a very important topic that has to do with gluten intolerance and its effect on the nervous system. Too often doctors kind of pigeonhole gluten intolerance, especially celiac disease, into the category of a digestive problem. And certainly it is an autoimmune disease, and certainly it destroys the small intestine in most people, and certainly for a lot of people they have digestive complaints. However, that pigeonholing to digestive only really causes us to miss tremendous amount of people suffering from neurological problems. We have seen this clinically for years, but it's always gratifying when one finds some research to back up what one sees clinically. So there's two different studies I wanted to talk to you about. One is out of Epilepsia, which is a scientific journal specifically associated with epilepsy and seizures. I'm going to grab it real quick just to get you the name. And the exact name was Systemic, meaning full body, and Neurologic Autoimmune Disorders associated with seizures or epilepsy. So in this particular study, they spoke about the fact that in celiac disease, 10 to 22.5%, so between 10 and 22.5% of those suffering from celiac disease actually suffer from seizures as well. So now that's just celiac, not looking at gluten sensitivity, but that is a very large percentage. And this is not well known. It's well known in the research. We know it, and certainly people in the field do. But the general doctor, we have two lovely young ladies who we're seeing age 8 and 9 right now, both one complete elimination of her seizures, the other one very, very close, which we have seen cases like this before. But the one little girl actually had what's called nocturnal seizures, so she was having seizures at night, therefore was exhausted because she wasn't getting any sleep. She was also acting in a fashion, personality-wise, that was very, very different. She was on the border of being diagnosed with ADD on top of the seizures, and her parents, it's a long story, but suffice to say, through a lot of brilliance on the part of her parents, they figured out that perhaps gluten was a problem, came to see us. Not only did we take her off gluten, but we also did the cross-reactive food test, which perhaps you've heard me talk about before. These are foods that kind of mimic gluten in the diet. Once those were all removed, her seizures literally stopped. Her doctors were a little skeptical about this. They actually put her in the hospital for what was supposed to be a 24-hour study where they did an EEG test, so basically monitoring her brain function throughout 24 hours. 24 turned into 48, turned into 72. So 3 full days she was monitored, and absolutely no seizure activity after what we did. So the parents are, as I said, wonderful and very committed and very smart, and they really pushed their doctor to admit to the fact that this was not that these seizures or seizure-like activity was completely responsible, gluten was completely responsible for this, and the doctor did state that. So that was actually a first for us, not the reversing seizures, we've done that frequently, but having a doctor corroborate that in sort of the typical medical model, that was a first. Another young lady suffers from grand mal seizures. These are the most frightening seizure you could ever want to witness. And she's 9 years old. She was having 2 a day when we met her, and she's currently down to 1 in 2 weeks. And so she's improving very, very dramatically, and we feel that full resolution is definitely on its way. And so we see this a lot, but to see in research this correlation is really brilliant. The other study I wanted to mention briefly was last year. The study from Epilepsia was this year, just a few months ago. This was last year out of The Lancet, which is a very respected U.S. journal, and it was called Gluten Sensitivity from Gut to Brain. And what was significant about this was really showing that association of how many patients suffer from neurological problems, the vast majority of whom do not, at least they estimate about 2/3 of the people with neurological problems induced from gluten have absolutely no digestive complaints.